Hello, everyone, and welcome back to Module 3. Now that we've explored sleep as a foundational occupation and we reviewed how sleep develops across the childhood, we're going to shift our lens slightly. And in this module, we're going to build on that foundation. This module is intended for professional learning. We are focusing on the occupational therapist role in supporting sleep through routines, environments, and participation. Sleep concerns are addressed within an interdisciplinary model of care, and clinical decisions should always be made in collaboration with the family and any relevant healthcare providers. By the end of this module, you should feel more confident recognizing sleep-related breathing indicators in children. You will be able to distinguish what fits within occupational therapy practice and what may require collaboration, and determine when and whom to refer to for sleep-related concerns. When we think about sleep-related breathing indicators, we're really thinking about patterns. We start by noticing what is happening during sleep. Then we look at how the child is functioning during the day. Are there challenges with regulation, attention, or participation? And we listen carefully to what caregivers are describing at home. It is a connection between those areas that help guide us. When sleep patterns, daytime challenges, and caregiver observations begin to line up, that is when we take a closer look. So what does this look like during sleep? Here is a list of some common nighttime patterns caregivers may describe. Loud or habitual snoring, mouth breathing during sleep, pauses in breathing or gasping, restless sleep or unusual positioning, night sweating or frequent awakenings. Again, we are not just looking for one of these. We are noticing a pattern over time. And in this video, this will show you an example of how nighttime breathing patterns can present. So imagine a caregiver is showing you this video and that they share with you this happens most nights. That alone could give us more clarity about what might be influencing daytime performance. If nighttime breathing patterns are affecting sleep quality, how might that show up during the day? During the day, disrupted sleep often shows up in ways that can look like behavioral at first. We may notice increased irritability or frequent mood shifts, and difficulty sustaining attention, impulsivity or hyperactivity, or sometimes the opposite, a child who seems tired, withdrawn, or less engaged in play. Participation may shift as well. A child may avoid seated tasks, struggle with transitions, or begin to have increasing difficulty at school with peers. On their own, these signs are not specific to sleep, but when they align with what the caregivers are describing at night, they may begin to tell a more complete story. And as patterns become clearer, screening helps us organize what we are seeing. We begin by looking at what prompted the concern in the first place. Maybe it's habitual snoring several nights a week. Maybe the caregiver has noticed pauses in their breathing, or even persistent mouth breathing. But we also consider what could be happening during the day. Are there ongoing regulation or attention concerns? Is participation shifting in subtle ways? Then we listen closely to what the caregivers are sharing. When we put those pieces together, screening gives us a more structured way to move forward. And this may include gathering a detailed sleep history and using a tool such as Pediatric Sleep Questionnaire to help clarify those risk patterns. We document how sleep may be affecting regulation, attention, and even participation. And we monitor whether or not these concerns persist over time. From there, we determine what makes sense. Sometimes that means continuing occupational therapy interventions when appropriate, and sometimes it means bringing other providers into the conversation so that our response supports participation across the child's daily occupations. This is a clear decision pathway. When sleep-related indicators are identified across nighttime and daytime function, we begin with structured screening. We gather caregiver history, we use the tools such as a pediatric sleep questionnaire, and document functional impact. From there, we ask a simple question. Does screening suggest an elevated risk? And this may include persistent snoring, observed breathing pauses, an elevated pediatric sleep questionnaire score, or continued functional impact despite routine support. And if the risk appears low, we may continue occupational therapy interventions, provide sleep education, and monitor patterns over time. But if the risk appears elevated, we communicate findings and collaborate with the appropriate provider, whether that is a sleep physician, an ENT, or even a dental provider. Throughout the process, collaboration remains ongoing. When screening suggests elevated risk, collaboration becomes an important next step. In pediatric sleep-related breathing concerns, collaboration often includes 3 primary providers. A sleep physician evaluates for sleep disorder breathing and determines whether further testing is needed. An ENT evaluates for structural concerns such as enlarged tonsils, chronic nasal congestion, or upper airway obstruction. A dental provider evaluates craniofacial structures such as the palate shape, the jaw position, and alignment factors that may be influencing the airway space. As occupational therapists, recognizing these patterns is just not about referral. We see how disrupted sleep affects participation, and this is what guides our next steps. As I was building this module, I realized it would be helpful to have something practical for you to use in the clinic and something clear for the caregivers to use at home. One handout is designed for the occupational therapy practice, and it outlines sleep-related breathing indicators, screening considerations, and referral pathways to support clinical reasoning. The second handout is designed for caregivers. It presents the information in a clear and accessible way so families can better recognize patterns and understand how sleep may be affecting daytime function. So if we step back and look at the big picture, here are the key takeaways. Breathing patterns during sleep can influence how a child functions during the day. Sometimes what looks like regulation or attention difficulty may be connected to disrupted sleep. Screening supports more intentional clinical decision-making. When patterns persist, this is where collaboration comes in. The earlier we recognize these patterns, the better the outcome for the child and the family. Thank you for your time and engagement. In Module 4, we will shift our focus to intervention strategies.